Hey, Practice Bobsy. It's D'Angelo again. And today I've got an awesome guest that you all are going to hear a lot more from in the coming days, weeks, and months. This is Dr. Dominic Glavich, general dentist. And he will be known to you, many of you guys, as the productive associate. Okay, so a lot of dental social media content, CE courses, things that are talked about in the groups are really dedicated to the practice owning dentist. That's just the way it is. But not every dentist wants to be a practice owner. And there are a lot of associate dentists who might want to be practice owners in the future, but right now they're not. And we kind of want to just bring another voice to talk to that audience. And that is why I'm bringing on Dominic today. So Dom, just go ahead, give a little intro of yourself, the type of dentistry you do, your journey to dentistry. I know that's a little unique as well. And then a little bit about why you're passionate about this topic.
Yeah, so I'm a general dentist in North Carolina, and basically my skill set is everything that I learned in dental school. I haven't actually taken anything outside of dental school that I do clinically. Everything that I do is from dental school. Luckily, I had some decent exposure to things like extractions and removable and endo. So I didn't have to take much with that. My school, there wasn't any specialty residencies, so the pre-doc students got to do a lot more with the specialty faculty there, which helped a lot. Um, but I practice right now 4.5 days a week, probably a 75% day on Friday. My practice is just general dentistry. I would say I do a lot of currently removable
Mhm.
and fixed. That's just kind of my demographics. But my first job out of school, I did a lot of extractions. So I guess it depends on demographically where you live and skill sets, based on where you live. And, I talk about that in the course too, how to pick that right location based on what you know. Um, but yeah, I mean, I bet, this is my third year out. I haven't been out too long, but I've learned a lot on the way. And, I thought about owning a practice at some point when I graduated. I'm sure other people do. But the fact is, the more I actually practice, the more that I liked coming home, not worrying about dentistry or not thinking about anything related to dentistry. I like that feeling and knowing also that you can be more flexible with, oh, maybe I don't want to work in this area anymore. Let me try another area. You have more flexibility in that aspect too. So it fit my lifestyle, and trying to find information out there regarding being an associate, it's kind of hard. Like you kind of have to go through Dental Town and go into the deep depths of those posts on Dental Town to find any information on fair compensation, things about contracts, like what, materials that some owners hate buying because it's so expensive, and things that you wouldn't really, I'm sure you think about a little as a practice owner, but not in the lens of being an associate. So I was like, there's like nothing out there for people that are associates. Like it's all, a lot of it is all ownership based, which can transfer to being an associate, but not in the same lens as someone that is working for that owner or group. So yeah, it inspired me to just kind of jot down what I've learned. And, I worked in two groups, and I'm in the second group now, which I love. And um, other associates there are like, yeah, I wish I knew this before working, or I wish I knew this material was expensive, so then I would have been proficient in another material, or I wish I had this in my contract. So there's many things that I was like, yeah, but if you actually looked on posts on Dental Town or anonymous forums, like they don't have this information. So I just put out what I learned, and I hope that others can benefit from it so they don't feel like they're by themselves. Because a lot of people, when they graduate, they're trying to find someone to mentor them in a way, right? It's
And
like,
I feel like,
oh,
yeah, a lot
I
of the culture for the new grads is like you're either on the fast track to be a practice owner or you work for a DSO and you're a loser. And
right,
it's like the attitude that's out there in the culture, and there's not much like in between. So tell me
right.
about like you talk to me a lot about building community. So talk about your thoughts on like building the community around the segment of dentists that you're talking about.
So yeah, I mean, I guess community in the aspect of, I've been fortunate to work with other dentists and, and kind of also see, my wife is a dentist too, like see how, she went through things before I even started. She finished before me, which was great for me because I kind of got to see how what she went through being an associate, and then I got to see where my friends went through as being an associate and questions that they would ask and kind of struggles that they would have. And I would sometimes I'd be like, I don't know, let me find out. And then I'd go to Dental Town or just like Reddit sometimes, and I couldn't find answers, like good answers, and also things that I wanted to know. And so when I found the answers, I was like, let's make something digestible so that people who have questions to whatever relating to being an associate, you can find it in this group. So that's the goal of the group, to kind of make sure people don't feel like they're alone. Because yeah, like you said, I mean, it's very black and white with new grads, and I think partially is some people that are faculty in dentistry were practice owners, and then students see that and they're like, oh, I want to be like this guy. But really, I mean, you can still have a great life being an associate and have all the flexibility in the world, and there's something to say about that, but there's just not no content or groups out there that really focus on that. And I feel like that's what the dentistry community is missing. It's missing basically a platform to where that can happen.
Cool. So when you're an associate, like you're joining an office and they already kind of have their own way of doing things, their own culture.
Right.
Your wife's a dentist, she's been in offices, you've been in a couple.
Hmm.
Can you talk about just from the associate's perspective, what is it like fitting into and joining the, the office culture of a practice? And like, what have you
Yeah.
seen that are good aspects of it, like where you're at now, or maybe like more difficult things at places that weren't as good as where you are now? Like, talk about just joining the culture of an office.
Yeah. So, I guess just like anything, the stuff that, if you're fresh out of school or if you're coming from a different office and you're going into a new office, there's definitely a shock to some degree, whether it's they use different materials. Some of the staff aren't trained up, or some are, and you have kind of the mismatch between today I have the non-trained assistant, tomorrow I have the trained assistant. Um, or the other doctor that was there, maybe you're replacing one, did things a certain way where you have to break those habits. And or the awkwardness where you see work that's not acceptable, and some people think it is, and you have to have those conversations. And it's more of, you want to go in with kind of a neutral, open mind presence and not disrupt so much right away. At least that's my strategy. But also it's hard because as dentists, we're so particular, right? We're doing very fine-tuned work, and we have our methods that work to us, and we're tried and true with that. So going into an office that maybe not has the same vision or the attention to detail that you have can be frustrating, and it's something that you kind of have to slowly work up to, because the last thing anyone wants is you come in and you try to change everything in a drop of a hat within like the first week, right? And you try to train people or say, oh, this is how I do it within the first week, because then people get frustrated and people start to question, is this, the right doctor that we want to have? So you almost have to see it as, you're in your house and you're going to another house for a get together, and you want to act your way and yourself at the get together, but you don't want to disrespect anyone. You want to be kind. You want to be attentive to other people's needs. So it's a dance, and being at two different places, I can tell you that if you find yourself in different jobs, I would expect to be in a drastically different environment. And if it's not, great, all the better. But I think that having that mindset to where you want to make friends essentially, but making sure that care and attention to detail isn't compromised. It's it's like walking on a tightrope sometimes. Because you find that some people just don't care, but then some people care a lot. So having those two personalities can lead to a lot of issues, um, but at the same time, at the core, it's just making friends, like you're at someone's house kind of situation, and just slowly inching into the direction of how you see fit. Because I mean, at the end of the day, you're the doctor, right?
Yeah.
And you're the one that's treating the patient, but you got a bunch of people that are extensions of you that are supporting staff. So you have to be mindful to their needs, how they communicate, but slowly inch them in the direction where you want to, versus kind of right away, okay, I'm the new guy here. I want this material. We're doing it this way. We're doing it that way. And that's your first
I think
day.
that's hard for a lot of dentists not to do.
Yeah, right. It is super hard because we're so particular. Um, and it's our personalities too. I feel like the average dentist is a go-getter, right? So, um, yeah, I agree. It's very hard, but I feel like that's where you can get the most respect from people, knowing that, you didn't try to change everything on the first day, even though they kind of expect it sometimes when they get new doctors.
Yeah, a metaphor that I've used before for like kind of that clash when you're joining a team is
Hmm.
like when you're an associate, let's use a restaurant metaphor. You're going to work at a steakhouse and you're going to be the chef and you're going to be the one preparing these excellent steaks, these really expensive steaks for the people coming to eat at the restaurant. And you're hired to be the to join the team of chefs at the steakhouse. And
Right.
it's a famous one, famous chop house, and you're like, hey guys, we got to switch our vendors. This meat's we're gonna use a different meat. And like, no, these are the
Mhm.
steaks we cook. And like, no, no. And like, you just joined the team. This is our restaurant. We're not
Yeah.
getting all new ingredients for you.
Right.
We've got a
Yep.
system. Because many times when you join an office as an associate, there's already been a filtration that's happened. Like an office has to be doing something right. They already
Yeah.
have to be so successful to a certain level where they're even growing and expanding to the point where they can have additional doctors.
Of
So they're
course. Yeah.
doing something right already.
Mhm.
And you don't want to, change the whole recipe. Maybe, like you said, you join not your first week, but as you become part of the culture and you understand what the goals of the office are, you understand what the goals of the team and the owner are, you can say,
Mhm.
hey, bringing to the table what I know and now understanding this culture, here's an idea that I have that might help our team, which is different than, here I am kicking the door in, which I think
Right.
you really highlighted that really well, Dom. Um,
Yeah.
and more of kind of another more specific question, leaning more towards the financial end of productivity. Okay. So
Mhm.
as you said, many of the CE and stuff in the online groups, it'll talk about how dental practice can grow and how the owner can make a more profitable office.
Mhm.
But if you're an associate and like your pay is tied to production, or the owner has production goals, like, hey, associate doc, your goal is to produce this much each day. As an associate, what is really in your hands to change your productivity? Like if the owner wants you to produce more, as the associate, what can you really do being a part of the system without changing
Right.
the rules? Because you can't say, okay, I'm going to produce more. I'm going to change this, that, and this to produce more because you can't change all that stuff as the associate. So if you want to
Right.
produce more, if you want to hit a production goal that maybe the practice has for you, how do you do it?
Yeah, that's a good question. Well, you kind of have to look at it to where what do you have control of and what do you not? So as the associate, you don't really have control of patient flow. So new patients coming in,
Mhm.
the practice handles all the marketing.
Yeah.
So then
Which,
you
I mean,
say, okay,
that's honestly one of the first things I do. Like if I
yeah,
want to make more, I'll market more to get more patients, get more customers. I do more marketing. That's the first thing
right.
I do. But as an associate, it's not the first, second, third thing you can do at all.
Mhm.
So yeah, keep
Yeah.
going.
So for me, when I go in, I was like, okay, well, I don't have control over marketing or how new patients come in, but you do have control over usually how you schedule. One, you do have control over decently, somewhat, big asterisks, to materials, what you're familiar with, and also kind of your assistants that are with you. So fine tuning those three things really helps you get control over efficiency.
Mhm.
So when you look at variables that you can't control, you say, okay, to heck with those, like that's out of my hands. And then you look at variables that you can control, you try to make those as efficient as possible. Because one, it leads to better patient care. You got a good assistant with you, you're going to do good work probably.
Mhm.
I find that the assistant actually really projects
Mhm.
how good their dentist is. If it's a good assistant, you're probably going to do good work. And if it's an assistant that you're really not jiving with yet, I mean, it's going to maybe be a rough time doing a procedure. So you have to look at it through that lens to where, okay, if I schedule something this way and I know this assistant is very strong with restorative or extractions, I want them with me for this. It's going to make it go by quicker. I'm going to stagger it so I can start another procedure 15, 20 minutes after I start this one. So you really have to look at it internally versus I feel like practitioners, they look at the external things, marketing, advertising, you know, things like that. Because at the end of the day, my goal is to do quality work efficiently and not have the patient come back with post-op issues. Because I find that if you're doing fast work, right, but it's not good, then you're going to be less productive because you're going to have more things come back to you.
Yeah.
And of course, that's still bad for the patient too, because the patient has to suffer as well. Um, so yeah, that's kind of my mindset going into it because it's completely different than being an owner. And I feel like people in these practice ownership courses, they focus more on real estate, location, marketing, dentist to population ratio. Whereas the associate, you're focused on, are your assistants trained up? Do the assistants know your materials? Like, do they give you the bond or the desensitizer first? Like, what's your protocol for that? What type of scheduling are you doing?
So it sounds like
It,
one thing that you feel like is really in your control is just like really building that relationship with your assistant.
yes, yeah,
Mm.
yeah, yeah. Because if they know that you're trying to do the best work for your patient and be efficient, I mean, it's hard not to get on board. And of course, there'll be some that you'll have struggles with, just like any person, right? But assistance and how you schedule are probably the two biggest things. Because of course, materials we can all adapt because I don't think there's many materials that are completely different with restorative and extractions and things
Yeah,
like
there's only
that.
so many things.
There's so many things. Yeah. So um, yeah, assistance and scheduling honestly are the two biggest ones.
Cool. So one of the seminars that you have coming out, which is like an introductory one that people can take, is
Mm-hmm.
on patient communication. So can you
Mm-hmm.
talk about maybe like give an overview of that and like how you feel like your journey to having better patient communication? Because I'm sure you just didn't pop out as like a fresh dentist, super
Mm-hmm.
amazing. So what was your journey to developing as a communicator with patients? Um, And how do you see yourself being able to help other associates in particular communicate better with their patients?
Yeah. So when I was in school, I tried to, when I would communicate with patients, because we had way more time in school, right? We would have like a 4 hour block for like a crown prep, you know.
Yeah.
But I would say, okay, if I'm talking to someone that has no idea what I'm talking about, how would I tell them what a crown is? And so that was my thought process going in, and then you know, I got a lot of good feedback from patients, and then I would tweak some of the analogies that I use. And because I think sometimes as dentists, we can just say, hey, you need a crown, and the patient has no idea what a crown is. They have no idea what's actually going to happen to their tooth. They have no idea why they need a crown sometimes. Um, so being focused on basically trying to teach someone that does not know the subject is kind of how I approach telling patients they need treatment. Um, and I use a lot of analogies in the course, and there's so many analogies. And I find that if you are a visual teacher, you show them x-rays, intraoral pictures, things like that, they come to um, not only respect you but trust you, because like really at the end of the day that patient was probably on your schedule for a couple months, and they are waiting probably 30 minutes on top of that before they
Mhm.
saw you. So they have a lot of questions,
Yeah.
and they probably don't know too much technical terms related to dentistry. So being able to dilute that information into something digestible for them with visuals, I mean, it's just like teaching anyone anything.
Mhm.
Like I'm gonna need visuals, and I'm gonna need a good explanation. And then if you are to do that, you gain their trust. They're more likely to come back. They're more likely to refer other people to you. But it all starts with patient education
Nice.
and pretending that this person is just, they don't know dentistry. Because if they do, they'll usually say, "Oh, tooth number 4, I had a crown." Like there's usually indications where someone kind of knows what
Yeah.
they're talking about.
Okay.
So, mhm.
So I do like to keep these right about half an hour, and believe it or not, we're already up on a half an hour for our time, Dom.
Jeez.
Um,
Yeah,
but before we go, I want to tell people a little bit about the like the private chat that we're gonna put in place
yeah.
for people. So for those of you guys listening, we're gonna have like a private group chat that you can join. And if you're interested, send a message to Dom or to me, and we'll
Mhm.
provide you with a link to join it. Okay, so the theory in general, and then Dom, you can kind of give a little more of your vision, is to establish that culture that we're talking about
Right,
for dentists who are associates. Because not every question or thing you want to say, you want to post in a Facebook group. That's why there's so
right.
many anonymous posts. Not
Mhm.
everything you feel comfortable saying because maybe you're not the boss, all right? So we want
Right.
to create a protective space where you guys can have those conversations, and Dom is going to be the leader of that to facilitate that community. And you can say a little bit more about your vision for it if I missed anything.
No, yeah, that's spot on. And it's really anything like, you're having disputes, or you just need kind of someone to talk to about a clinical situation, or you got a question about a contract, really anything. It's a community so that we don't have to go searching for 30 minutes on, you know, unknown forums to try to find an answer.
Yep. Yep, and the private group chat is going to be the first iteration of that, and as that grows and the community grows, if we need to add like a more built out platform for that, that's something we can definitely do.
Mhm.
Like library of resources, something that's like a searchable database. All of those things are things that we can implement as the community grows for the associate docs.
Mhm.
All right,
Yeah, absolutely.
cool, man. Any parting words? Otherwise, I think this was a great session.
No, yeah, it was great. And if anyone has any questions about the course, feel free to reach out to D'Angelo and and we're happy to help you out.
Yep. All right, guys. See you later.
See ya.